Yes, good afternoon. This is Dr. Endozine. I am updating Mildred Strom's patient 75324-C. I'm updating her medical care and her diagnosis. Regarding her diagnoses being updated, we have come up with new diagnoses and a treatment plan, otherwise known as a care plan, for the patient, Miss Mildred Strom, otherwise known as Mildred Dreary. Well, her latest diagnosis is in the literature, I would stress. If it's in the literature, it's in the literature. Yes, her list is as follows, and I will follow up thereafter with her new medication orders. Beginning with opposition defiant disorder, otherwise known as ODD. It's in the literature, I assure you. This is real. Yes, indeed. You're not questioning me, are you? This is in the Diagnosis and Statistical Manual of the Psychiatric Association of America. That's correct. And no more impertinence out of you. You will not ask any questions, even after I'm finished, or you will be medicated. Perhaps we will take you into consultation as well. She has also a very common disorder known as seasonal affective disorder. How convenient. Otherwise known as SAD. Oh, how dreary. Yes, and she also has some offshoots of those. It's very complex diagnoses, but they're all interrelated, whereby readily treatable by old medications that we used to use, which we found new uses for. Therefore, we can renew the patents, so we don't have to come up with new medications for another 17 years or so. Yeah, at any rate, however, she also is suffering from, let's see, the one is, it's known as BAD, and that's bowel abnormality disorder. NAG, and that's nanoanalgesic gliopathy. Very common, I assure you. You might even have it yourself. Come in for an assessment. We'll be more than happy to give you our latest unbridled attentions. Oh, so let's carry on here. She also has a very common diagnosis, which is actually very prevalent with people that manufacture vaccines for some reason. I don't know why. It's called GREED. It's called Generalized Regurgitative Encephalopathic Excessive Desire Disorder. And so these diagnoses are especially for the DMDD diagnosis, you must be older than 3 and have more than 3 tantrums, and the behavior cannot be appropriate for this age. So, and only I am qualified to determine the appropriateness of the behavior, so you of course must consult with me on that matter and in the proper regards, and you must have the acceptable behavior yourself, or you will be treated quite well and permanently. Yes. Present symptoms are requisite for treatment of DMDD, or I like to refer it as dumbed down disorder. Yes, because of the medication side effects, but they don't mention those in the little handout that's attached to it, that it's too small for anyone to even read, even if they had a magnifying glass. Perfectly fantastic. These are smart people that work for me. Oh, so the prerequisites are that the patient receiving the medication, which will be discussed further as we proceed, must be before the age of 10, but not before the age of 6. Let me be clear upon that. You must not be 10. You have to be younger than 10, but not before age 6. Get it? This is in the literature. Read it yourself. I'm not kidding. This is very real, as is your required attention to receive my state-of-the-art opinions. So let me repeat myself at the risk of being repetitive. It is not administered, I might say. I have to be proper about this. I make enough money. Never before age 10, but never before age 6. Or, finally, it cannot be given after the age of 18. By then it's too late. And this is for all patients. No one's different at any given age. You're all the same, according to the literature. Let me be clear on that. You will conform to the DSM guidelines in the literature. Shall I repeat it one more time? Okay, this is in the literature. Never is the patient to be treated before the age of 10, but not before the age of 6 or after the age of 18. Because as we all know, ladies and gentlemen, before the age of 10, we're all the same. None of us develop differently than anyone else. We're all the same. We are unified. Yes. Unification and diagnosis are crucial to our state-of-the-art care for all. Some symptoms of disruptive mood dysregulation disorder or opposition defiant disorder. I stress disorder, but according to the dictionary, it could be just as easily disruptive dysregulation mood disease, as most people have a disease of the mind. Or you could say a disorder of the mind. It's all as you wish. So some symptoms, as I said before, overlay these two diagnoses, like persistent irritability between tantrums without periods of relief, like sleep or smiling, no relief, none. I hope I'm being clear about this. Let there be no mistakes. It is rather vague, isn't it? So that's all in literature. Now, we shall proceed with the records here state that at this point in the literature, the practitioners of psychiatry do not have sufficient data from clinical trials to apply psychiatric medications other than what we might gather from the reactions of our recipients, whom we lavish with our state-of-the-art care. Mandated. So, I pose the question that there is a definitive pathological process that has characteristic signs and symptoms according to whether or not it's a disorder or a disease. You see, disease is a noun, a pronoun, or an adverb because it's dis and it's ease. So it's dis-ease. But what is diseased? That is a noun, is not, or an adjective. I forget. Well, it's very important in the literature in order for it to rise to the nebulosity that is required of my profession, and to rise to the technical protuberance of my nebulosity and state of the art. Yeah. Now you're beginning, the drugs are taking effect. I mean, yes, you're beginning to understand. So, we are coming up with new quantifications to make it clear for the general public to understand the differences between disease and disorder, because there are differences. So to make it easier, since I also work for certain government entities, which will remain anonymous, even though we're funded by your tax money, of course, very generously, I might add. Oh, yes. Oh, you like my jewels? Yes, and you should see my house. Yes, so, recently in the literature that you are allowed to see, that has been adjusted so that it is within the correct proctoscope of your mental transverse curriculi, we have come up with new definitions for Ebola is now a disorder. It's not a disease. Yes, there's the fatal Ebola disorder. Yes, we're coming up with the vaccine for that, though. Since we invented it, we might as well. Oh no, not that one. That was the other one. And let's see, we have the cancerous. This is a real gem, a gold mine, in fact. The cancerous cell irritability disorder. Readily treated by our oncological specialists that are well versed in state-of-the-art enzymatic molecular transmutation of the globulized necroglial otoscope, which penetrates and perforates the ventricles of the transcendent uterus, thereby reglomeralizing the follicles. Isn't that just fabulous? I love modern medicine. And this is state of the art. Let us proceed. So, as a prophylaxis to the excretion of guidance regulation number 9754Z, and this is in specific regards to Mildred Strom, patient 59743. We approach this with a full spectrum of treatments as the treatment protocol as prescribed in the prophylactic care of her said diagnoses. Whereas we proceeded with a treatment that I had mentioned in one of the past records of Propoxygon 9 testicular removal, penetratory enhancement, I believe it was, and that had a very good reaction with Miss Strom. The medication at first didn't work, so we had to quadruple it. However, then she was rendered to a state whereas her then practicing physician was able to get the power of attorney required for us to acquire her estate, and her asset forfeiture was promulgated surreptitiously. And as we speak, she now resides here at Gurney State Hospital at Malden Cross Downs. Fabulous. So, we'll have more updates for you periodically regarding her pharmaceutical care. Oh, I forgot to mention, this is crucial. She has started to receive the mandatory vaccinations now mandated for the elderly to protect them from themselves, because at people her age, the medical advisors in the literature now recognize the patient as needing antibodies against themselves. So, through a process where we extract the enzymes and the crystals and reformulate the polypeptide neurons and reinsert them after certain splicing techniques that we learned from McDonald's and et al. McDonald's pharmaceuticals. Oh, you didn't? Oh, they haven't come out yet. Yes, all you people, the Happy Meals really do make you happy. Temporarily, but whatever. Yes, they're the bipolar burgers. You think it's funny, but it's big money. At any rate, so seeing as how the elderly's body starts to act like a virus on society, they must be inoculated against themselves to create antibodies against themselves, which prevents them from proliferating for extended periods, so as not to inconvenience people like me, who are actually, I suffer from greed myself. Yes, but the treatment's working. All it takes is a lot of money and power and tax money. Money, money, money's money, 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 money.